I'm happy to make this presentation on behalf of the ILO, the International Labour Organization, and the topic is ending stigma and discrimination and addressing intersecting vulnerabilities. The key message is engagement of indigenous peoples is key. Uh, First, to give the big picture, this year in the ILO, we released a report on the implementation of ILO's Indigenous uh, and Tribal Peoples Convention 169, which is the only international treaty concerning indigenous peoples. And this report presents some data, some estimates about indigenous peoples. And there are three important messages emerging from that. First is that indigenous and tribal peoples are estimated to be 476.6 million globally, which is over 6% of the world's population. They are three times more likely to be living in extreme poverty than non-indigenous peoples. And the third extremely important point emerging is that 20% point more likely to be in the informal economy than their non-indigenous counterparts. And this gap is even higher for indigenous women. So we are actually talking about a population that's huge and that is living in extreme poverty. But we need to make sure that all the policies and programs that we develop are in consultation with them. So this is the main message coming from this report. Moving to the next, the study that I'm going to present today is the study that we did on the stigma and discrimination that indigenous peoples living with HIV or those who have TB face in the world of work, particularly in the employment settings. We did this study last year with the aim to build knowledge and understanding about the situations of indigenous people living with HIV or TB in the workplaces. And the key to this study was that it was conducted by the Canadian Aboriginal AIDS Network, which is the Secretariat of International Indigenous HIV and AIDS Working Group. We were extremely happy to collaborate with this group and with the indigenous peoples because this meant that we were implementing our principle that we work with the communities. The study methodology involved four stages. In the first step, we did the literature review, we looked at whatever was available in terms of indigenous peoples and their situation in the world of work and HIV and AIDS, as well as TB. We did some in-depth interviews with indigenous peoples who are living with HIV or those who have had TB at some stage. Then we did some focus group discussions to validate the results. And these focus groups covered all regions and all continents. Uh, in each of these, in the methodology, again, indigenous people played a very important role in the design of questionnaire, as well as in the design of focus group discussions. So their participation played an extremely important role. Key findings coming from this are, first of all, the literature review showed that there's still lack of data. There's not enough research which has been done on the situation of indigenous peoples living with HIV. So we don't have the full picture yet. People face double discrimination. First, being indigenous is it itself keeps them marginalized, and then having a HIV or TB adds another layer to that. If somebody has a different sexual orientation, like LGBTI communities, that's the third layer that adds to that. They face discrimination in the workplaces in the matters of getting jobs or promotions, getting fair treatment. Sometimes they lose the confidentiality norms are not respected. And there are legal policies in place, there are laws in place, but the enforcement of those is not that good. Another finding coming from this is the gender discrimination. Indigenous women living with HIV have experienced more discrimination than the male counterparts. Um, Access to health is a key issue. They face stigma and discrimination. Health providers very often do not speak their languages, so they don't get to access the right information, and there's a stigma and discrimination in the attitude of health providers towards indigenous people. That's another important point that seems to be emerging. The ILO Convention number 169, there's very low knowledge about this convention, and therefore there's a need to talk a bit more about it and do more advocacy around it. To give some of the highlights of what people said in this interview, that, for example, having an indigenous name itself counts to some discrimination. This participant from Latin America said this, that we have the indigenous name, and I think this we are less valued in the work environment than our other colleagues. Similarly, a participant from Africa spoke about discrimination in the workplace. Particularly, the co-workers don't want to associate with you, they don't want to eat with you, and this is happening in different places according to them. Health workers, they don't have the this person coming from Latin America mentioned, um, they look down upon us. They feel that we indigenous people may not adhere to the treatment, etc., etc., and that is extremely problematic to us because they are not aware of our culture. Another specific example, people losing job, and this person from Asia and the Pacific region, employed in the formal sector, said basically they didn't want to me back on the job. They just gave me a settlement and I had to lose my job. So these are the findings, and now coming to recommendations. The first recommendation is that involvement of people is extremely important because they have their concerns, they need to be heard, particularly to see how the confidentiality is affected and how policy and workplace protection measures can be taken. Second is about developing materials in indigenous languages, training service providers on stigma and discrimination so that they respect confidentiality and they respect the cultures of indigenous people. There's a need to have campaigns on stigma and discrimination, very specifically targeted towards indigenous people, accessible to them in their own languages. We need to work a lot more on strengthening the legal and policy environment around this issue. So ratification of Convention 169 is extremely important recommendation coming out of the study. And there's a need to improve mechanisms to support legal claims around discrimination, because sometimes it takes a long battle to get whatever is due to people. And we need to really work more to implement and enforce legal mechanisms. In the area of workplaces, the ILO has a particular recommendation on HIV and AIDS, which is called recommendation number 200. So these are the two main instruments of the ILO that need to be promoted in the workplace, all workplaces, so that people work together on the issues of indigenous peoples, HIV and AIDS. As I said in the beginning, we don't yet have the full picture. So therefore, the study recommends that we need to gather more evidence for research and indigenous specific data so that we can take evidence-based responses. While doing this research, it's important to keep in mind that how would this research benefit indigenous peoples and the communities in supporting their own goals and taking care of their own needs. As we are in the era of COVID, I would like to speak 30 seconds on this also, because this is leaving indigenous peoples behind as it is leaving so many other vulnerable groups in vulnerable situations because of lockdowns. So we have developed a policy brief on COVID-19 and the world of work, ensuring no one is left behind in the response and recovery. Three important messages here: that the COVID response needs to be rights-based and it has to deliver on the SDG pledge of leaving no one behind. There are huge impacts due to economic breakdowns and alarming signs of income losses and access to health for groups in vulnerable situations. And there are all these intersecting issues such as people with disability, with HIV, indigenous peoples and migrant workers. They're not actually a homogeneous group. They often face multiple and intersecting forms of inequality, discrimination, and marginalization. So finally, two messages to conclude. As we say in the ILO, the decent work opportunities for indigenous peoples can really build economies and protect the environment. And secondly, it's important that we engage with the communities, because their voices, their perceptions, their needs need to be on board in designing any policy or program. There are two important portals that the links are there. All the links are embedded into this presentation. And I hope that the COVID situation, as we move towards recovery, will not leave indigenous peoples behind. Thank you very much.
Un gran saludo a todos y todas. Como seguramente ya se ha mencionado, se estima que somos 476 millones de pueblos indígenas que vivimos en aproximadamente 90 países del mundo y que representamos alrededor de 5.000 culturas diferentes a pesar de toda esta diversidad y nuestros conocimientos y prácticas ancestrales centradas en el bienestar. Los pueblos indígenas a menudo seguimos enfrentando grandes desafíos como la mortalidad, la discriminación, el estigma, la violencia y otros factores que nos están colocando en la línea de pobreza y vulneración de nuestros derechos humanos. Por tanto, nos vemos desproporcionadamente afectados por una variedad de problemas que incluyen la mala salud sexual y reproductiva, el VIH, SIDA, la tuberculosis, la hepatitis viral y las infecciones de transmisión sexual. Nuestras propias investigaciones y algunos reportes de los sistemas nacionales de salud de algunos de nuestros países revelan el alto grado de riesgo que tienen ciertos pueblos indígenas por diversos factores determinantes. A pesar de algunos datos epidemiológicos, dan cuenta que la prevalencia del VIH puede ser menos del 1% en algunos pueblos, pero también hay algunas etnias donde es mayor al 5%. Si tuviéramos datos desagregados por pertinencia étnica, nos mostraría la verdadera magnitud que significa la epidemia del VIH y otras enfermedades en nuestras comunidades del mundo. Algunas políticas locales han desarrollado planes de trabajo para atender la situación del VIH en algunos pueblos indígenas, desde entradas a las comunidades para brindar información, pruebas rápidas obligatorias, tratamientos, pero en muchos de los casos no ha surtido el efecto esperado, y en otros ha generado conflictos entre las comunidades y los equipos de salud. Ambos ejemplos, tanto la falta de recojo exacto de dato étnico y casi la nula coordinación con las organizaciones indígenas locales, está retrasando la respuesta a la epidemia en los pueblos indígenas y nos estaría sacando de la meta de llegar a cero. Y no solo estos esfuerzos se diluyen, sino que estas epidemias pueden hacernos desaparecer. La Agenda 2030 para el Desarrollo Sostenible se basa fundamentalmente en el empoderamiento y la inclusión. Sin embargo, es un enorme desafío, sobre todo si se quiere ser equitativo e incluyente. A pesar de que vemos grandes avances, aún tenemos una enorme tarea de poner fin a la epidemia del SIDA, particularmente dentro de algunas comunidades indígenas. En su 17ª sesión, el Foro Permanente para las Cuestiones Indígenas de Naciones Unidas convocó al Programa Conjunto de Naciones Unidas sobre VIH-Sida, al Fondo de Población de las Naciones Unidas y al Grupo de Apoyo Interinstitucional de Asuntos de los Pueblos Indígenas, para organizar en el 2021 una reunión mundial de expertos sobre pueblos indígenas y VIH, con el objetivo de proponer acciones claves para la disminución de la epidemia y sus efectos en los pueblos indígenas de manera conjunta, e instaron a los estados a trabajar de manera colaborativa con todos los pueblos indígenas para contribuir con esta iniciativa. Desde hace 2 décadas, los pueblos indígenas nos hemos organizado con el fin de evidenciar la situación del VIH en nuestras comunidades. Hemos trabajado de manera articulada, hemos establecido alianzas estratégicas entre nuestras propias organizaciones del mundo y hemos constituido y reconstituido nuestra propia historia. Hemos fortalecido nuestros propios conocimientos sobre esta epidemia, compartido nuestras experiencias y quizás también nuestros fracasos en la búsqueda de soluciones. Y hemos alzado nuestra voz para ser escuchados y vistos no solo como el problema, sino fundamentalmente como parte de la solución. En estas reuniones entre nuestras propias organizaciones indígenas hemos puesto en relieve nuestros conocimientos, nuestra comprensión y la percepción que tenemos nosotros mismos sobre la epidemia, sobre sus síntomas. Y hemos puesto en práctica algunas actitudes y hemos evidenciado el gran rol que juega nuestra medicina tradicional en el tratamiento de dichas enfermedades. Entonces, bajo esta propuesta se proponen los diálogos de saberes, con el fin de facilitar el desarrollo y el fortalecimiento de modelos interculturales de salud. Esto como una manera de lograr una atención de salud centrada en la persona y con un enfoque comunitario. Una vez que hemos transitado este camino, hemos sostenido reuniones positivas con algunos miembros del grupo de apoyo interinstitucional sobre cuestiones de los pueblos indígenas, con el objetivo de diseñar de manera conjunta cómo serían estos diálogos interculturales. Esto nos ayudará a articular esfuerzos locales para la lucha contra el VIH-Sida en los pueblos indígenas. Todas aquellas, y además no solo del VIH y SIDA, sino también de todas aquellas infecciones como la hepatitis o la tuberculosis que están presentes en nuestros territorios y amenazan nuestro bienestar. Pero estas formas de articulación de esfuerzos requieren un conjunto de acciones claves, entre los cuales tenemos fortalecimiento de las organizaciones indígenas locales, el respeto de los conocimientos, el uso y las prácticas de saberes ancestrales, una comunicación horizontal y equitativa, con la participación de mujeres, de jóvenes y nuestros hermanos indígenas de las diversidades sexuales. Una estrecha colaboración entre los diferentes actores claves, pero excepcionalmente se requiere que esté basado en el buen vivir, en el bien común y la buena fe. Tres aspectos fundamentales para nuestra coexistencia global. Entonces, creemos firmemente que esto nos puede encaminar de manera conjunta a aquellas recomendaciones dadas por el Foro Permanente para las Cuestiones Indígenas y nos puede devolver la confianza de que nosotros los pueblos indígenas no nos vamos a quedar atrás. No estaremos fuera de las metas de llegar a ser, pero eso significa que es un esfuerzo conjunto de todos y todas, como una sola fuerza. Pero siempre vamos a seguir afirmando y alzando nuestra voz y diremos que todo con nosotros y nada sin nosotros. Muchas gracias por su atención.
Okay, namaste everyone. This is Rajesh Didiya from Nepal, an indigenous member and the president of National Association of People Living with HIV and AIDS in Nepal. So here, this is my presentation, Bridge to Dignity, with in rehabilitation center and HIV/AIDS in Nepal. So here, this presentation is all about the showcasing a new HIV and addiction program, which is supporting national strategy of Nepal. So this is the project or program we call Dignity, a Bridge of Dignity for people living with HIV/AIDS and HIV positive and key population of Nepal. And here are my empowerment center, we call farming institution, where we train the HIV positive people and people living with other infections and PWID community. So this is organic based farm here. And here, the Bridge to Dignity program, it's all about addiction treatment, what we do here in Nepal, and to provide them a free, drug-free environment and start the antiretroviral treatment and provide them the trainings, work, and the revenues to generate, to spend dignified life in local community in territory of Nepal. So here, a principle I'm working with this, I'm the living example of that. The reason these program we generated or I generated is because I was started as a drug user since when I was age of 12, and then after while I was in drug addiction for 12 years of that, and in 12 years I have destroyed everything in my life. And once in the time I was in rehabilitation of drug treatment center, and there I have so much discrimination towards indigenous community as I'm Newar. So I feel so much bad experience there, and after that I started to initiate some work for indigenous people, especially to Newar community of Nepal. And at the same time I diagnosed with HIV, and I was shocked for 2 months that I could not accept that, because I was shaded needle once. So once I was infected by HIV. So at that time I was my CD4 cell were below 200 above. So I need to start immediately the antiretroviral treatment. So at that time, the stigma was in high level, so it was very difficult to cope up. And after that, I started a small organization which we call Suruat, a treatment center. And there we have lots of indigenous people are involved on that. So here, in right side of presentation, we have a picture. This is the indigenous group of Nepal, we call Newar, who they are the inhabited since from 5,000 years in Nepal. So we work for a community, for us, as in principle of nothing us without us, and the meaningful involvement of PLHA in Nepal. So here, Suruat, it's an because I have initiated that to treat and to support the people who are facing problems due to stigma, due to HIV, and due to drug addiction. So we initiate our organization. It called Suruat. Literally, it means the beginning of new journey and new life. So we are as a friend for a change. So we run the programs in the principle nothing us about us without us. So we run treatment center. We provide assistance to oral substitution therapy, and we provide trainings. We raise awareness campaigns. We facilitate trainings, livelihood program, and other awareness campaigns. So as well as we provide financial assistance for HIV positive and key population, and even for drug user community in Nepal through the livelihood support. So this is my small organization building here. We provide all the services here, including residential facilities and trainings, income generation skill. So in the right side, it's a logo of Suruat, which has two hands. It represents gender equality. The right hand, it's the hand of woman, and left hand, it's a hand of male. So it's provide us enlightenment and a power. The top part, it's the enlightenment of a new journey. You start new life, no matter living with HIV or no matter with uh, drug using. So we could success. That's the example of this. So then we are providing 90-90-90 goal achievement assistance to Nepal government. You see, we are working for testing 90% of testing. We are contributing retain 90% of other goal, and then we are providing assistance to 90% new infection diagnosis. So then we have experiment models that we provide new trainings, new scope, and new way of life. So we are working with the various experience and various multi workers as we are as a positive group. So we are rising the best of us to the community. So these are in plans. So here in national strategy plan with the principle we are advancing human right, gender justice, zero tolerance for prejudice, and even related to HIV positive or new key population and prevention and treatment. We are working on that, identifying the gaps of program, identifying the new ways to work, and in all the aspects we are providing the assistance in meaningful involvement of HIV positive people. We do innovations, we do healthcare, and we do advocacy. So among these we are contributing to the goal of national strategy and even SDG goal. You see, where we are working for children's, we are working for adolescents, we are providing assistance for HIV positive people accessing treatment, and we are immediately offering their the essential needs in goal 3. Then again you can have a look, we have another goal here. We work for a new HIV infection in prevention method. So we reduce inequality in gender. We work for young people. You can have a brief look in my presentation here. So we have lots of elements here. So we work for human right and we work for justice as well. So in SDG 5, we work for gender equality. So we have a balanced work We don't do any discrimination to the female or to other third gender or other related issues. We work equally for them, and we work for peace as a SDG 16 goal. So we have a strong institution for injustice, and we fight for that. And then we work in a partnership for our international achievements, reliable strategies, and all the information about that. So these are the elements of our indigenous group work in Nepal, what we are doing by Newar community. And for example, another our achievement, we are working with internationally to lots of stakeholders. As I have started with the drug user, then I started a small organization. And now I'm representing the community of Nepal as a president of HIV positive people in Nepal. So we are working with NAPN, National Association of People Living with HIV/AIDS. We are associated with that, and we are working with the AIDS Healthcare Foundation. This program is supported by AIDS Healthcare Foundation. So all our livelihood skill are provided by AIDS Healthcare Foundation, and we have international working indigenous working group for HIV and AIDS. We are partner of that, and I'm a leader representing from Nepal for that group. So these are the beauties of this program. Whatever we are doing for us, and it's for us. So my presentation, it's based for stigma reduction through agriculture and a bridge to dignity through indigenous way. So these are the elements, and thank you very much for listening my voice and seeing my presentation. I'm very much grateful to present my small effort to contribute in HIV/AIDS and to halt the stigma and discrimination in HIV and AIDS. Thank you so much, and namaste.
Hi, my name is Jeff Roth. I'm Lakota Sioux from the Standing Rock Reservation in North Dakota. I'm from the United States. I'm also a member of the United Nations Permanent Forum on Indigenous Issues. I'm a consultant in Indigenous health here in the United States, and a former board president of the National Native American AIDS Prevention Center. So I want to follow the previous speakers and talk a little bit about our needs in Indigenous communities and how we effectively tackle the HIV epidemic. Our title, Foundations for a Coordinated Global Response, HIV and Indigenous People. The International Indigenous Working Group on HIV and AIDS and the International Indigenous HIV and AIDS Community have worked to put together a set of recommendations for the international community and for countries. I worked with them. We spent our scarce resources, both time and money, and largely what we came up with is no different than what the Indigenous community has been saying for the last 20 years. This is not because of a lack of creativity on our part, but because of a lack of attention or motivation by the countries of the world, and because of a lack of attention by our international partners and holding them accountable. I don't normally start off like this. I'm a light person, I'm friendly, but it's difficult to go through this exercise again. I've been here before. Given the fact that we've already done this so many times and no one's listened, we're still here at the beginning. It's been too long. We won't stop until we get to zero. We need action now. We need attention now. And I pledge to do what I can to get there. So when I do presentations, I like to discuss my biases and give context. In this case, I've been involved with the International Work Group on HIV and AIDS for a number of years. And now I'm a member of the UN Permanent Forum on Indigenous Issues. So it's part of my responsibility as a member of the Permanent Forum to ensure that the United Nations addresses recommendations from the Permanent Forum in a timely manner. And I take that responsibility to heart. I see these recommendations from the international Indigenous community on HIV and AIDS as part of that responsibility and to help me do that. We're one Indigenous people working together to get Indigenous people to zero by 2030. So I want to read one section there we go. I want to read one section from the setup that sets up well our entire approach to the recommendations. We collectively state that it's imperative to ensure that any approach towards solving Indigenous population issues, and especially the HIV/AIDS pandemic, must be exceptional. That means it must be uniquely designed and centered on the Indigenous worldview and understanding of life. And equally important, it must acknowledge and work around the circumstances brought about by colonization and compounded through centuries of cultural rejection from colonizers, exclusion, and forced acculturation schemes. So let's get right into the recommendations. The first recommendation is to establish an epidemiological data baseline that is created from the ground up, is culturally informed, and maintains local Indigenous community ties. Our population cannot get started in preventing and treating until we get information to understand this epidemic in our communities. Through research that is Indigenous, community rooted, and includes a holistic health approach. In our full recommendations document, we list principles that must be followed in the implementation of these recommendations, and others like ongoing free, prior, and informed consent, ensuring policies are wellness focused and trauma informed, and that they include feedback from heavily affected populations, such as women, LGBTQ2S, sex workers, drug users, and others. The second recommendation is to develop a system of health resources and educational curriculums grounded in Indigenous cultures while exploring environmental and Indigenous research tools. This recommendation, while requiring additional tools and resources, also incorporates the critical role of environmental health as fundamental to Indigenous communities. The third recommendation, create a regional Indigenous HIV/AIDS epidemiological baseline work groups of experts across the globe to provide oversight, guidance, and assistance. While we see encouraging efforts within regions of the United Nations, there doesn't seem to be a coordinated international effort to get our Indigenous populations to zero globally. We need leadership at the regional level in the form of working groups that can provide advice, oversight, and guidance on achieving data baselines, as well as developing interventions. These Indigenous leaders should be from the regions that they are serving, and the working groups can also and should also include technical experts from the agencies. This needs funding, and we also request that. The fourth recommendation is to implement all recommendations with the goal of eradicating this pandemic. Results should foster, develop, and maintain relationships that lead to a sustained presence for Indigenous HIV prevention and treatment activities. We included this to ensure that activities were approached in a way that ensures they are not just one time. We need to then to continue until we get to zero. There is a lot more specific details in the recommendations, but the overall purpose is to ensure that there's a sustained effort. The fifth and final recommendation is that there needs to be a collaboration between the international Indigenous HIV and AIDS community and the United Nations Economic and Social Council leadership to bring attention to the Permanent Forum on Indigenous Issues recommendations and coordinate on their proper implementation. Practically all of the previous recommendations that I've talked about here have already been made by the Permanent Forum to the pertinent UN agencies in the last 2 decades. And to our account, the corresponding actions have not taken place. It's necessary to work together to ensure there is a coordinated effort among the involved UN agencies to create a synergy and implement our Permanent Forum recommendations. So in wrap up, I've identified 7 Permanent Forum recommendations on HIV and AIDS that cover all of the topics of these community recommendations. The Permanent Forum recommendations date back to 2003, and they have no implementation reporting on them from any of the cognizant UN agencies. The UN agencies and the countries have ignored the Indigenous peoples' recommendations. I'm going to do what I can to change that. I hope this has been useful and informative. I hope it's sparked an idea for you Participation is vital at all levels, and I would welcome your feedback. Please let me know. My contact information is here. I appreciate your time. Thank you.